country, amazing people, great food, very, very warm hospitality. But on the flip side, yesterday I also witnessed a massive humanitarian challenges. People are still recovering from the cyclone. Part of the country is still affected by droughts, number of social challenges, not sufficient food security, the water and sanitation challenges. So it's a mixed feeling of amazing country and beautiful people, but on the other hand, also a large portion of population facing a huge humanitarian challenge. In Madagascar, we have the Malagasy Red Cross, which is our member, and we always support and work with and through the Malagasy Red Cross here. Our focus is purely humanitarian, being a humanitarian organization. And here, the few things I have learned and witnessed has been the consequences of the climate crisis. Too much rain or too little rain, a drought that impacts the food production. And when that happens, it impacts people's lives and livelihoods both. Also, because of climate change, the frequency and nature of the disasters are growing. The cyclone are very, very frequent, affecting different parts of the country. And the intensity of the cyclones getting worse. And when the country is faced with multiple disasters and crises, the resilience of the people to cope becomes a challenge. And that's what, as IFRC and the Malagasy Red Cross, our main concern is and our main focus is. Whenever there is a disaster or crisis, we have a global system of solidarity to support the Malagasy Red Cross. We have funding mechanism, we have appeals mechanism, we also have mechanisms to mobilize goods and humanitarian resources, the source capacity to deploy. So whenever there is a disaster and crisis, we mobilize those capacity, and we have done it a number of times for Madagascar. But we are also increasingly focusing on what we call building the community resilience, primarily on climate and health-related issues here, because that's very, very relevant. And yesterday I could witness some of the activities in Mananjari area, for example, supporting people with cash for their shelter, or providing or developing model shelters so they can resist the cyclone, developing community centers when cyclone comes, people can actually evacuate to a higher land and where there is a community center. And these community centers can be used as schools when there is no cyclone. Or there is also the facilities where you can actually have preparedness stocks, training to the communities, having trained volunteers, working with the community leaders. So basically through multiple approaches, trying to have that community resilience so that it reduces the impact of the disasters. And actually, in some cases, it prevents the disasters to impact people's lives. It works. It actually helps those people. Now, the issue is the humanitarian need seems to be huge. What we are doing, is it helping everybody? No. The needs are just too many in different parts of the country. And that's where everybody needs to put our efforts in coordinated way, in a proper cooperation to address these issues. The impact of the climate crisis here is very, very visible. Too much rain, too little rain, too many cyclones, too many floods. And of course, Madagascar alone cannot reverse the climate crisis. It's a global issue, so the whole globe has to come together. But here, there can also be a localized solution. Protecting the coastal areas through tree plantation. Building small diverse places. Building small barriers for the water to flow. There could be localized solutions also that reduces the impact of the climate crisis. So I absolutely believe that more needs to be done in Madagascar and more can be done. We do have professional staff, we do engage professional workers, but the Red Cross, the essence of Red Cross is volunteers. That's basically and it's extremely important. The volunteers come from the communities themselves. They are not brought from anywhere. And when you look at any disaster and crisis, the first person to help is family and neighbor. That's why the volunteers become so important, to have volunteers from every community. These volunteers are trained on how to do the humanitarian work, and when something happens, these are the first people to respond. When you come from the communities, you care the most. The coordination happens probably at 3 different levels. One is the coordination here within the Red Cross family, within the IFRC network family, because we ourselves need to be working in a coordinated manner here in the capital, but also many provincial branches and the district branches of the Malagasy Red Cross. Then there is a second layer of coordination among the humanitarian organizations, because there are many international and national humanitarian organizations. So and there are coordination mechanisms here in the country, and Red Cross is actively involved on those coordination mechanisms. And the third and equally important coordination mechanism is coordinating also with the government and the public authorities. And so we coordinate at all levels. Sustaining the humanitarian funding is always a challenge, because a lot of the humanitarian work is done through donations, the voluntary donations. The public donates, the private sector donates, the government donates. So when your action, your primary resourcing is from voluntary donations, sustaining that is not always very easy. That means you have to be in touch with the public and with your partners all the time. So one of the key strategies is to have that regular contact, regular discussions. But at the same time, you got to deliver what you promise needs to happen. And it needs to happen in an accountable manner. So if you say we do this, if we say we will build 1,000 houses, we got to build 1,000 houses. And when you demonstrate that delivery and the accountability, then the partners are willing to contribute. Now, in the Red Cross, our approach always is the first, to have those partners in the country itself. Of course, the country's capacities varies, country's economic development varies, so not every country have the same financial means. But even in a poorer countries, there is a capacity in the country. So our first objective is always to have that domestic capacity. And of course, when the needs surpasses the capacity in the country, then we mobilize the international solidarity. No, I think the Malagasy Red Cross is trying to build partnerships in the country with, of course, a number of other organizations. I also had some discussion with some of the ministers here to see how we can maximize some of those capacities in the country, and that's really the direction we want to take here. And some of the work is already happening, but I believe that there is more possibility here in Madagascar, and with some of the discussion I had in the last couple of days, I see more opportunity.